All right, welcome everyone. So my name is Dr. Lindsay. I'm the medical director and associate veterinarian at the Animal Care Center. Thank you so much for coming to visit with us tonight. This is part of our C.A.R.E series, which is a monthly client education seminar that we put on that has lots of different topics, and we're happy to be able to share with you some pet health information today on dental health. So sorry this is a little bit late. This was our topic for February, but it's a pretty common topic and one that I get a lot of questions about. So because of the weather last month, we bumped it to this month. So we're celebrating Pet Dental Health Month just a little bit late this time. So today we're going to be talking all about teeth. This is a little bit about me. So right after I got done with vet school, so I'm a Purdue grad. It's a university in Indiana. I went there for undergrad and vet school. I went into the United States Army and served as a veterinarian for 4.5 years before I landed in Utah and found Dr. Pam's practice and joined her team. I love to be outdoors. This is my dog Gibson wearing my husband's helmet. It's just really cute. We're big skiers, hikers, things like that. So Utah is perfect for us. And today what we're going to talk about is pet dental health. So dental disease is the most common thing that we see in veterinary practice health-wise for your pet. And the hard part is that dental disease isn't always what meets the eye. So what you can see is only a small fraction of your pet's dental health. 60% of dental disease actually occurs underneath the gum line. So this picture of this tooth being like an iceberg is a really good analogy. And it can be really, really hard to see, and that's where we come in, where we can help you to determine how your pet's teeth really are health-wise and what we can do to make sure that they keep them for as long as possible. So we're going to talk about the importance of dental health. We're going to touch on some common dental health problems, and then talk a little bit about, I want to walk you through what a dental cleaning looks like, because it's actually very similar experience to what you and I go through when we go to the dentist, but it's a little bit different in pets because it's actually done under general anesthesia. And then finally, we're going to touch on some at-home pet dental health care that you can do to keep your pet's teeth nice and sparkly white. So today's seminar is going to be about 45 minutes long. The last 15 minutes we're going to have a little question and answer period, but if when I'm going through things you have any questions or anything that you would like to add, Danny, who's one of my technicians, is in the back. She has a microphone. Just hold your hand up and she'll be right over to you to answer any questions and things. All right, so why is dental health important? So by the age of 2, 80% of pets have some type of dental disease, whether that is inflammation of the gum line around the tooth, whether that is tartar, whether that is, I had a cute little 18-month-old today that came in with a broken tooth. These things happen quite commonly, especially with our dogs that are really big chewers. Does anybody have any power chewers in the audience? I was going to say your dogs are especially high risk because of their high chew drive. So pet dental health is so important and it affects almost every patient that I see every day. And dentistry, so plaques starts the whole problem off. So we have our tooth and we have this sticky plaque film that sticks to the tooth and is really hard to get off, and it just worsens with time. Eventually what happens is little minerals get deposited in that plaque and it becomes this hard, really stuck to the tooth tartar, and that's something that once that tartar forms, it's difficult to get off without a professional scaling. So we need to catch these problems when they're just starting, so that way we can do some things to intervene and get the disease under control. Eventually what you'll see is the tartar has bacteria in it that can lead to inflammation and infection of the gum line and the structures surrounding the tooth. So you can get what's called gingivitis or redness or irritation of that gum line. And eventually you can get bone loss and even infection of the root of the teeth. And the hard part is you're not going to see that infection until you start to see that your dog is having pain in their mouth, or sometimes they'll even come into us with big swollen spots on their cheeks because they end up getting abscesses at the roots of their teeth. And dogs will lose teeth and be prone to infections in other areas of the body. So one of the things that I see the most often is pets that have more severe dental disease can actually have bacteria that go from their mouth to other areas of their body, like their bladders, their kidneys, their liver, and cause other infections that can be very, very worrisome. And this is a really cool, there is a dental website that I'm going to show you that has a lot of videos at the very end, but they had some really cool pictures on different areas within the different areas within the United States. And actually Utah has one of the higher level risks for pets with having dental disease, which I thought was pretty interesting. I think it's because we have a really high dog population and some really good pet owners that are taking good care of their pets' teeth. All right, so what are some signs that your pet is having a dental issue? So has anyone's pets ever had a dental issue that they've had to bring them into a veterinarian to have their teeth looked at? All right, what have you seen?
Well, she had my little dog back there, Patches.
Oh, look at Patches. Oh, she's cute. Oh, cool.
My little dog had really bad mobility, and then she had a big swollen just face.
Yeah.
I see that in humans, but I had no idea. Oh, sorry, I thought I was loud enough. Testing 1, 2, 3. Oh, okay. But anyways,
I love it.
So you and Dr. Verona helped me out a lot, so I just want to make sure I can learn a little more because I'm unfamiliar. But yeah.
So definitely, so you can see mobile teeth, you can see swelling of the cheeks themselves. You can see, so one of the common things that I have owners tell me is my dog's breath is awful. It just smells so bad because who doesn't I let my dog kiss me, that's pretty common. And when they get in your face and you're like, whoo, something is not right there. So if you have any odors to the breath that are abnormal. Sometimes too, dogs can have drooling where they'll drool more than normal, or they can have issues with eating their food where maybe they're chewing on one side of their cheek. Or another thing that I see a lot is they're not as interested in their hard foods, but if you offer them something soft, they'll eat something soft, or even they'll go to chew and then they'll drop it. That's another really big one. But you can actually too look at the teeth and you can see a dark brown buildup on the tooth. Redness of the gum line is another really big one. So you can see on this dog, he's got quite a bit of what's called gingivitis or redness of the gum line on the top of the teeth. Sometimes you'll even notice blood. So if your dog is chewing and then you see blood on a toy or a chew, something along those lines, or you go to look in your dog's mouth and they usually are fine with it, but suddenly they're shying away. I actually had one of our grooming dogs, she's really good for having her teeth brushed, and suddenly her mom, she just wouldn't let her mom near her face. She ended up having a piece of stick stuck up in the back of one of her teeth, and we didn't know until her mom started trying to look at her mouth a little bit better. And then just changes in behavior. So other things that we can see too is sometimes dogs can get so sore that they can actually be a little bit aggressive. So they can start to growl at other animals or people because their mouths hurt so bad. All right. And who is at risk? So every pet is at risk. But there are certain dogs that we worry a little bit more about dental disease. So one of the biggest things that puts your dog at a higher risk is if your dog is very uncomfortable with having his or her mouth examined, or allowing you to do anything like teeth brushing or wiping at home. The age of the pet, so our older pets are also a little bit more at risk because they've had a lifetime of chewing and playing with things and picking up things with their teeth. It just puts their teeth at a little higher risk. The size of the pet, so who's got a great big dog? No great big dogs? One great big dog. Who's got itty bitty little dogs? All right, so our itty bitty little dogs are a little bit higher at risk because their mouths are a little bit more crowded, the teeth are closer together, and that can allow plaque and tartar buildup to accumulate more quickly. So the size of the dog is also really important, and I think it also has a lot to do with being able to brush. It can be a little bit harder in some of the small dogs to reach some of those really back molars and things compared to, a giant Great Dane that's teeth are just right there and easy to see. Diet is huge as well. So dogs and cats that are fed a canned diet are at a higher risk for developing plaque and tartar because as they chew on the food, it helps to scrape the tartar off of the teeth. So soft foods don't allow for that friction quite as well. Our chewers are a little bit more at risk, especially for things like fractures because they do, like my dog wore down his front two teeth and actually broke one because he's a high ball drive dog. And then some chronic diseases that lessen the immune system like diabetes or Cushing's disease can also put dogs at a little bit higher risk. Does anybody else have any questions about higher risk dogs for dental disease? Yeah.
How common is dental disease with genetics?
Oh, so the question is how commonly affected is dental disease by genetics? And I think genetics play a very big role in dental disease. So some animals, and we don't know why, are born with a more porous enamel, so plaque can stick to the tooth a little bit easier than others. So I think that plays a huge role. Yeah.
So my biggest question that I've always wanted to know.
Yeah.
So how come dogs have like dark plaque or like calculus? Rather like in humans it's like yellow or white. Just curious.
And I think it all has to do, so the question is why is the color brown versus yellow? And I've definitely seen yellow plaque as well, but we tend to see such a heavy accumulation. I think we're seeing a similar color, it's just a heavier volume that's making that color look darker. And then I also think diet has a huge role to play in that because we have a different basically mineral composition of the plaque and tartar than humans, the dogs do than humans. So yeah. All right, great questions. I love having a dental hygienist here, that's so fun. All right, so what are the most common dental health problems that we see? And then we're gonna break these down and go over them one by one. So the most common thing that we see by far is what's called periodontal disease. So does anyone know what periodontal disease means when I say that? I'm looking at my technicians back there. I hope you guys all know. All right, they're shaking their heads yes, but they're not gonna. One is an earlier stage of the periodontal disease, and then we get all the way to our advanced stages, which is in a stage 4, and we'll talk a little bit more about that in the next slide. Fractured teeth are huge. We see quite a number of fractured teeth, whether it's from chewing on hard surfaces, on rocks, on toys, or just general wear and tear. Like my dog's was just from doing things that he does every day, and he finally wore down his tooth enough that he broke it. Malocclusions, which means that the dog's bite does not line up exactly perfect, and we'll go over some of our most common malocclusions today. In our babies, so we have baby teeth that don't fall out when they should. And then finally, we see little masses or growths on the gum tissue quite commonly as well. All right. So we'll go over periodontal disease because this is one of the most common things that we're going to see in pet dental health. So like I said, we're graded from grade 0, which means they have perfect gum tissue, and then grade 4, which is our very advanced stages of periodontal disease. So we talked a little bit about it. So how does this all start? So bacteria in the plaque get underneath the gum line of by the tooth, and it starts to cause infection and inflammation of that tooth, and it gets hardened because different minerals basically calcify and thicken that plaque into really heavy tartar. And then you start to see that these bacteria secrete different toxins that start to cause tissue damage around the tooth itself. And it slowly eats away at the bone, at the little ligaments that hold the tooth in its socket against the jaw. And it will slowly eat away at the bone surrounding the tooth as well. These get really serious quite quickly. You can start to see damage to the gum tissue and bone around the tooth itself. You can actually, especially on the upper teeth, particularly the canine, you can see that a little hole forms in between the tooth itself and then the nose. So that's what's called a fistula. You can see, actually, I've had dogs that have gotten so much bone loss that they've had fractures of their jaw secondary to the amount of bone loss that they have. It's especially common in small dogs in the very front of their jaws, which is called the symphysis. And then lastly, bacteria going from the mouth to other areas of the body and causing infections in other places. So that's one of the most serious things that we worry about with periodontal disease. So how do we treat this? So this is treated with dental cleaning under general anesthesia, so you can use a scaler and get that plaque and tartar out from underneath the gum lines. And in some of these severe cases, we're going to be extracting teeth and treating with antibiotics and things like that. And we'll go over that when we talk a little bit more about dental cleanings themselves. But this is the most serious, one of the most serious problems that we see with dental health. All right. Any questions about periodontal disease? Yeah. Yeah.
So I have a question. It's about male occlusion.
Yeah.
So like with humans, like with orthodontists, we can like reset that. But with dogs, what do we do for that part if they're not?
So we actually have very similar things that we can talk about in dogs. So not every malocclusion needs correction by a veterinary dentist, but there are a lot of times that we do basically braces for dogs if they have a malocclusion that's causing issues where maybe their teeth are hitting against the roof of their mouth, or they're having a bite where they're having a lot of pain or having issues with eating. So we have very similar ideas. And actually, Dr. Lauren, you had a kiddo that got braces not too long ago. Mia. Yeah. I was going to say, so she had a bite where one of her canines was actually touching the roof of her mouth. So they used braces to correct her bite so that way it wasn't hitting the roof of her mouth. So that actually exists in veterinary dentistry as well. Yeah. And we are super lucky to be in Salt Lake because we actually have a board-certified veterinary dentist that's down in Midvale that does some of these specialty procedures, which is really nice. All right, so this is another one. So this was actually a kiddo that I just did a dental cleaning on just a few weeks ago. So this is a kiddo that came in for a fracture. So fractures are very, very common. And we have a few teeth that are more commonly affected than others. So the big canine teeth, which are the big kind of fang-looking teeth on the top and the bottom. Dogs have 4. And then the upper, what is called the premolar 4, so the 4th premolar, and that's actually what this tooth is. This is a big tooth. This tooth has 3 roots, and this dog has done what's called a slab fracture. So he's cut off a slab on the side of the tooth. And this one's really bad because it actually goes underneath the gum line. Fractures can be complicated or uncomplicated. So complicated fractures are like this one where they actually involve what's called the pulp cavity of the tooth. So you can actually see this hole. That is what's called the pulp cavity, which is the living portion of the tooth that contains the blood vessels and the nerves. And these are very, very painful. So the biggest thing that we worry about is that dogs have a significant amount of pain because the nerve is exposed in these fractures, like this, where the pulp is open. And they are also at risk because bacteria can sneak in this little hole and get to the root of the teeth and actually cause an abscess at the root of the teeth. So how do we treat these? It really depends on the fracture. So unfortunately, in cases like this where the pulp is exposed and the fracture goes underneath the gum line, the best option is to remove this tooth by extraction. But if this tooth did not have a fracture that went underneath the gum line, we could potentially consider things like a root canal, or if the pulp cavity is not exposed, and we can actually do something that's called crown restoration, where we restore the crown surface and protect it from further fracture, just like in people. And this is great because with our dentist here, she offers a lot of these capabilities that weren't always an option. So I especially like my experiences with military working dogs, and you know, their teeth are really important for what they do. So when they would break a tooth doing bite work or something like that, we would do a root canal to preserve that tooth and keep the structure of their bite. And that's really great for those dogs. Or if your dogs are competitive dogs, like I know we have quite a few competitive dogs out here, just to maintain that jaw structure. All right. So malocclusion. So this is that bite that just doesn't line up quite perfect. There are a lot of different types of malocclusions. I've hit on some of the most common in our PowerPoint. So this is a really cute picture of a dog that has what kind of bite? What do you think this might be? Overbite, yes. So the top jaw extends past the bottom jaw, and this is what's called an overbite. So the biggest things that we're going to look out for in a bite like this is see how those bottom canines are going up towards the roof of the mouth. The biggest concern would be is if those teeth actually push into the roof of the mouth. So this dog is actually a puppy, so you can see these teeth are a lot smaller, and they're a little bit lighter in color. They're almost more transparent where you can see through them a little bit better. So a lot of times we're going to act, even though these are baby teeth that are going to fall out, so that way they don't have issues with that bite long term, with the palate issues from the tooth touching the top of the jaw. But the good news is in our babies, a lot of times these are going to fix themselves as they grow. Not always, but lots of times. One of the most common bites that we see is actually what's called an underbite. Does anybody have a brachiocephalic or a short-nosed dog? No squishies here? Oh, there's a squishy. Okay, this is really common in our short-nosed dogs, so our Boston Terriers, our pugs, our bulldogs, our boxers, our Frenchies, you know, some of those breeds. This is actually a very normal malocclusion for certain breeds. We're just making sure that the occlusion isn't to a point where it's causing any issues with their bite, where they're not able to chew like they normally should, or if they're having any teeth that are rubbing against other teeth that we're worried about them breaking teeth and things like that. And then the last is what's called a wry bite. And this is a little bit of a layman's term. So this is when one side of the jaw grows faster than the other side of the jaw, so their mouth looks crooked. So one side is farther forward than the opposite. And it's just something that happens in some dogs as they're growing, where that growth just doesn't happen as easily as it should, as evenly, as it should. So the complications would be the loss of ability to chew like they normally should, and then also that rubbing of the teeth against other teeth or against the hard palate, which is the roof of the mouth, or other structures like the tongue too is another big one. So what do we do in these? In a lot of babies, we're going to say, let's watch it and let's see if they grow out of it. But if it's to the point where it's causing lots of damage, we can actually do what's called shortening of the crowns, where they'll actually remove part of the tooth that you can see and make it shorter. And a lot of times they'll do a root canal at the same time if it's a permanent tooth. They can remove teeth. I actually had a cute little puppy that I did this for. She had an overbite and her bottom teeth were poking into her palate, so we removed her 2 baby teeth. And her adult teeth will come in with time, and we're just going to watch and make sure as she grows that fixes itself. And then lastly, orthodontic treatment. So actually getting with the dentist and seeing what we can do with braces to correct the teeth and move them slowly to correct that malocclusion. Some malocclusions are going to be easier to fix than others, though. So I tried to find a fun braces picture, but I didn't have one. I'm sorry. Does anybody have any questions about malocclusions? All right. Moving on. So retained baby teeth. This is something that we see very commonly. So baby teeth are what are called deciduous teeth. So deciduous teeth should typically fall out within the first 6 months of age or so. Some puppies, though, it takes a little bit longer. So we're watching your puppies as they're growing and as they're developing to make sure that bite looks great and that as they grow, the big teeth come in and the baby teeth fall out. This is something that's most common in our smaller breed dogs as well. So many times what your veterinarian will recommend is let's watch these teeth, and if they have not fallen out by the time that we're spaying or neutering, that's a really good opportunity for us to remove any teeth that haven't come out, just to be on the safe side. But what you can see is that in this dog, so the adult tooth is coming in, and then the baby tooth is still present. So as that tooth comes in, this baby tooth should fall out, but in some cases that doesn't happen. And then we really worry because we have two teeth that are in one space that are really crowded, and that encourages plaque to start forming more easily, and they're more predisposed to actually having long-term issues with that adult tooth. So we want to get these out if that baby tooth hasn't fallen out when the big tooth comes completely in. So we want to watch those dogs really, really closely. The most common teeth that we see this happen to is the big canine teeth. All right. So did anybody's babies have any baby teeth that didn't come out? Yeah, I was going to say, I thought Tobes did for sure. They're really, really common, but the good news is that very easily treated, especially when they're at the age for spay and neuter. But if they're having any issues, we probably won't wait until that date to spay and neuter. If they're having some teeth issues, we may elect to remove those teeth a little bit earlier. Okay. All right. And this is the last health problem that we're going to talk about today. If anybody has any questions on things I don't cover, we can definitely go over those. So we're going to talk a lot about growths. And growths in the mouth are very difficult to really determine by just looking at them with the naked eye to determine how worrisome they are, because we can see things like hyperplasia, which is an overactive or overproductive gum line. It's really common in certain breeds, like the boxer is a dog that I worry a lot about what's called gingival hyperplasia. We see benign growths or non-cancerous growths, which are things like epilus, which come from just the gum tissues itself. But then there are some really worrisome growths. So we can see things like squamous cell carcinomas, which is actually a type of skin cancer, or melanoma, which is also another type of skin cancer. And they don't always, so when I think of melanoma, I think of a dark, angry black spot. That doesn't have to be the case. They can be light in color too. So anytime we see a growth, we're typically recommending removal of that growth and to send it for what's called pathology, where they look at it underneath the microscope to tell us what exactly type of mass is this and how worried do we need to be, because the treatment's really going to vary. With gingival hyperplasia or those epilus, which are the benign growths, removal should be curative. They may get them again with time, but if it's one of those more worrisome masses, some of those treatments are going to be very different. They're going to be surgical removal, and sometimes you actually have to remove teeth and sections of bone or jaw to truly get rid of that cancer, because they are quite aggressive. So anytime you see a growth in your dog's mouth, I do recommend having it evaluated. And I will say, in my personal experience, I err on the side of caution and actually end up removing these and sending them for pathology because they can be so worrisome. Any questions about different masses? Yeah? No, you're great. I love it.
So with the melanoma,
Yeah.
how do they get that? Is it from sitting in the sun, and is it on the gingival tissue, or how do they get it?
So with melanoma, so the skin versions of melanoma, we do worry that there is a UV component. So with the gum tissue itself, unfortunately, they think that has a lot to do more with genetics. So certain breeds and certain lines of dogs are more at risk. Like the one that I think of immediately when I think of melanoma is a Rottweiler. So that breed particularly, dogs that have pigmented gums are at a little higher risk because they already have more melanin in the gum tissue itself. And they mostly happen in the back of the mouth, especially on the bottom jaw. So you'll see tumors in the very back of the mouth, and they can be those ugly black raised spots, or they can even be, little small white, start as little small white spots too. Some of them don't have to contain the pigment to be melanomas. All right. So now we're going to go into the fun stuff. So we're going to kind of walk you through a professional dental cleaning. So the name for dental cleanings changes a lot. The term that they like right now is called COHAT. So it's a complete oral health assessment and treatment. So if I say that term, that's what that is. It's kind of the new fancy way to say dental cleaning, because it truly encompasses everything that we do, because it's a lot more than just cleaning a dog's teeth. So before your pet comes in for their dentistry, we're going to do a physical exam and determine their grade of periodontal disease, and start to evaluate if they're a good candidate for a dental cleaning, because the big difference between what happens to us when we go into the dentist and what happens to dogs when they come in to see me is that it's done under general anesthesia. I wish I could tell all of your dogs to open up and say ah and just sit still, but that's just unrealistic for 99.9% of our pet population. So after we do our physical exam and we know the extent of your pet's dental disease, and we say yes, heart and lungs sound good, otherwise this pet is in great shape, we're going to do what's called pre-anesthetic blood work, because I want to make sure that your pet is as healthy on the inside as they are on the outside. We're going to assess organ function to make sure that they can truly tolerate the anesthesia and that you have a happy, healthy pet following their recovery from their dental cleaning. And it's a good thing too. Like, I will tell you, I found out that my dog had chronic GI issues when I got him ready for his first dental cleaning. I got back his pre-anesthetic blood work and it was a little bit off, and then we kept working it up and found out that he has a mild form of inflammatory bowel disease. So it's something too that can let us know if there is a chronic issue going on that maybe we just didn't know about. And one of the newer things that we've started adding into our dental protocols is using a medication called Cerenia. So Cerenia is an anti-nausea medication that's given the night before a dental cleaning to help to minimize any tummy upset secondary to the anesthesia. And it's really great. You just give it with dinner and then they come in for their cleaning. But they've done some really nice research that it shows that they have less post-dental cleaning complications, and they actually return to eating a whole lot faster than they used to, which is one of the best things that I want to see when a pet wakes up from anesthesia, is that they're interested in their food still. And then the night before their dental cleaning, they're going to have no food after 10 o'clock to make sure that their stomach is empty before their surgery. There are going to be a few cases where maybe that's not the best. So if you have a really young puppy that's maybe getting a baby tooth removed, we may offer them a little bit more later than that. But in those special circumstances, we're going to tell you whether or not this is going to be the plan for your pet. But water is just fine. You never have to withhold water for these guys. All right. So the day of their cleaning, when they arrive at the vet hospital, they're going to get another physical exam because things change day to day. We're going to make sure that they're still healthy and fit to move forward with their dental cleaning. We're going to review the blood work and make sure that everybody's on the same page and that everything looks good and we're ready to move forward. And then they're going to get what's called pre-sedation, or a pre-anesthetic medication. And this is a medication that will allow them to start to relax, and it will also help to control pain and discomfort during the induction or getting them under general anesthesia. And once they're nice and relaxed, we're actually going to put a little IV catheter into one of their legs. And this allows us to give them medications and to give them fluids during their procedure. It's especially helpful to maintaining blood pressure and things like that while they're in surgery. And we're also going to let them just breathe a little bit of nice oxygen. So this is a dog just getting some oxygen before he's getting ready to get sleepy. And then the pet is placed under general anesthesia, and we're going to move forward with the dental cleaning. All right. So this is a picture of a dental technician doing a dental cleaning on a dog. So we're doing a professional scale and polish. So the first thing that we're going to do is remove the plaque and tartar from the crown of the tooth, which is the part of the tooth that you can see, but also underneath the gum line, because that's where periodontal disease happens, is underneath the gum line. That's one of the biggest key reasons of why this is done the way that it is, and pets are anesthetized, because it's so important to get that tartar from underneath the gum line. So typically it's actually a veterinary technician, and then it's supervised by the veterinarian. So my girls are doing the cleaning, and I guess I should say guys too. We have some guys doing cleanings now. And then I'm supervising and monitoring their anesthesia while the technician is doing. So we work in a team of 3. So as the doctor, I'm supervising, I'm evaluating teeth, interpreting radiographs, and then I'm also making sure that everything's going great with the other 2 parts of the team, which is you have your dental technician that is actually doing the scaling, the polishing, the x-rays, and then we have an anesthesiologist technician whose whole job is to make sure that the pet is doing well under general anesthesia. So they're monitoring vitals every 5 minutes, they're maintaining their blood pressure, they're giving pain medications. These girls are working hard. I was going to say it's a full-time job. I was going to say I think all the technicians back there are shaking their heads to the anesthesia is the hardest job of them all. And then once the teeth are clean, we're actually going to take x-rays of the whole mouth. So we're taking x-rays of every single tooth because, again, 60% of that dental disease is happening underneath the gum line. So unless you take x-rays, you're missing it. And once we've evaluated the x-rays, they're going to polish the teeth and make sure that after the scaling, so when you scale the teeth, it creates little tiny micro scratches on the teeth. They're polishing those out and getting a nice shine to the tooth. And then that's where I'm going to come in and I'm going to do a complete oral health exam. So I'm evaluating every surface of every tooth. We're looking at the roof of the mouth, we're looking in the back of the throat, we're looking at the tongue and underneath the tongue for any abnormalities. And then we have a chart that we list anything that's abnormal. If there's a pocket, if there's a tooth that's loose, if there's a tooth that's broken, if there's teeth that are missing, if there's a change in the bite, any of those things are going to be annotated really nicely on a record. And then if there is anything that is diseased that needs treated, so say we need to do an extraction or we have a pocket that's formed between the tooth and the gum, we can pack that with an antibiotic gel to treat that pocketing. We're going to do all of those things while the pet is anesthetized, but that's one of the very last steps that we're going to do. All right, and then this is me recovering my dog after his dental cleaning. This is at our house, this is not at the clinic. After the anesthesia, so as the pet is waking up, a technician's sitting with the animal until they're awake, until they're able to walk and eat and go outside to go potty to make sure that they're recovering nicely. It can take, though, 24 to 72 hours after general anesthesia to wear off. And I will say with my older dogs, I tend to notice that the recovery period gets a little bit longer. With my dog, the first dental cleaning, he was like a firecracker the next day. And now he's a 10-year-old. His one last November, the next day he was still a little off, and then 2 days later he was more like himself. By the third day, though, he was completely back to his normal self. So it can take a little bit longer as pets get older. You can see a lot of different things. So pets can have some changes in their behavior where maybe they're more clingy, or they can even be more withdrawn. They can do the opposite. They can just be a little bit groggy, maybe not quite as active as normal. One of the most common things, though, that I hear from owners is that they whine or they vocalize. And that's because of the medications that are still in their body from the anesthesia itself. It's what's called dysphoria, so their body just feels a little out of sorts after the anesthesia. But it should resolve with time, so just we support them through and encourage them as best we can. They can have a really sensitive mouth, especially if they've had extractions. So a lot of times if your pet's had extractions, we'll let you know to feed a soft diet for a few days, or maybe even a few weeks if they've had a large number of extractions or a really big extraction like a canine tooth. They can even have some blood-colored discharge if they've had extractions, so their saliva will have a little bit of a reddish hue to it. And typically we're going to say no hard treats and no hard toys for 2 weeks after a dental cleaning, just to make sure if that mouth is sensitive or we have an extraction site that's healing, we give that time to heal and recover. And then depending on the pet and what type of dental extractions and things were performed, we may send home pain medications or antibiotics as well. All right, so now we're going to talk about dental pet health prevention for dental disease. So I need a volunteer to start passing around our fun raffle tickets. So what we're going to do is pass around a raffle ticket. Oh, actually, no, I'm going to draw a raffle ticket. Just kidding. Leah's looking at me like you don't know what you're talking about.
Well, I forgot to bring the raffle ticket.
Oh, okay. Yeah. Let's do that, and then I'll put it in my purse so I can't see whether I'm pulling a raffle ticket or whether I'm pulling a sticky note. I'm going to be really objective about this one. So everybody just make sure that you write your name, and then actually just your name should be fine because you're all here. Some of these folks might not be here. The next part is, so we have this gorgeous clean mouth. Now we want to keep it that way for as long as we possibly can, knowing every pet and every human will eventually need professional dental care, but we want to try to do some things at home to space out the time in between these dental cleanings. Ideally, I like to get a year in between dental cleanings if possible, but some pets need dental cleanings more frequently. You know, every 6 to 12 months is pretty common for most pets. And then there are those amazing dogs that their owners are on it and they get dental cleanings every few years, which is incredible. So the gold standard, and one of the things that we really try to stress is professional, so besides regular cleanings, is actually brushing or wiping the teeth regularly. I was going to say, Danny wipes, doesn't he? I was going to say, I'm pretty sure I thought he likes his teeth done. Oh, I was going to say, I was like, you guys wipe. I was going to say, we got a lot of people. So
Mine all get brushed.
Mm-hmm.
They like
Brushed. Nice. And I was trying to find a picture of Dr. Pam's little schnauzer, but like she'll flip her on her back and use a little Oral-B toothbrush to brush her teeth. And some dogs will eventually get to that point. But typically what I have owners start with is actually wiping the teeth. The first thing we have to do is get your dog comfortable with having hands in and around the mouth, safely for them and for you. So the first thing I do is I pick something to use as a wipe. You can use anything like a tiny little 4x4 gauze square. They actually make little dental wipes that you can use that have an antibacterial solution on them. And then you can also just use, an old kitchen dish towel and cut it into little squares. And the first thing we're going to do is start to introduce the wipe near their mouth. I'm not even touching their mouth or their teeth. I'm just kind of holding it right up to their mouth and letting them smell it. If your dog is like, whoa, I just don't know about this, you can put some tuna juice or chicken broth on that area, on that little wipe, to see if that allows you to get it closer. And then once they're okay with having the wipe near the mouth, we're going to lift up a lip, wipe 1 or 2 teeth. The next day, 3 or 4, and slowly build up till you're able to wipe the whole outside surface of the tooth. You don't really have to worry as much about the inside of the tooth because their tongue, as they chew and just move their tongue daily, it will wipe a lot of that bacteria and plaque off of the teeth. So really focusing on the outsides of the teeth, and especially those back teeth. So many dogs have teeth that are so far back that when you just lift up their lip, you really can't see them. So you actually have to kind of get your finger in the back of their mouth and scrub those back teeth. And then if you say, wow, they're rock stars, they are really doing well, you can start to introduce toothbrushes and things. So they make veterinary specific toothbrushes that are a little bit more narrow, and they have a nice long handle so you can reach the back of the tooth. They also make little toothbrushes that fit on the end of your finger so you can wipe the back of their teeth as well. I think it's a lot of trial and error to find out what your pet truly tolerates, and know that something is better than nothing. Even if they will not let you near, like my dog saw the Oral-B and he was like, bye, and was not having it. So we've settled on brushing, and that goes great, but I think it's a lot of finding what they tolerate and building up slowly over time, knowing they're not gonna just let you get in there usually and scrub right off the get-go. It takes time. And no, it may take a few months too to get them to that point. So start when they're babies if you can. And then there's a ton of different treats and things. So we all have our kind of favorites for different dental treats and chews. One website I really love it's a board of veterinary dentists that made a website that has a list of products that they say, yes, these things are great. They really help to prevent pet dental disease. Is called the Veterinary Oral Health Council, and you can pull up for cats and dogs different products that they recommend to prevent dental disease. A few that we carry in our hospital that are really common that a lot of people really like are the OraVet chews are really nice. They are a nice green color, and they actually are one of the only treats out there that even after the pet is done chewing them, they're still effective because they have a little chemical in them that attaches to the tooth that prevents plaque from attaching to the tooth. So it's a little bit different than a lot of other chews, but most chews are meant to, as the dog chews on them, it's scraping that plaque and tartar off of the teeth. They also make different veterinary diets. I actually forgot, the Hills rep sent me with this really cool basically it's like a screwdriver which acts like a tooth, and he put whiteout on the end of it, and you're supposed to use it and crunch it against a TD, which is their dental diet. And it actually is meant, because it's a big size kibble, it scrapes the plaque and the tartar off of the treat as they eat the food. So this is a complete diet. It can be used on its own or as treats. And there's a lot of different dental diets out there. This is just one example of them. And then regular veterinary care. So a veterinarian should be looking at your dog's teeth at least once a year, but in those higher risk dogs every 3 to 6 months, to evaluate how fast is their dental disease progressing, and is there anything that we can be doing to try to slow it down. Some dogs that are very predisposed to developing dental disease, we actually use things like sealants that help to prevent plaque accumulation on the teeth in those dogs. Like I think of my little kiddos, like I have a few puppies that have really porous enamel where their parents are doing everything they can, but they cannot get the plaque to stop building up, and that's where sealants can be really helpful in those cases. Yeah. So it depends on the sealant and the chewer. They can last, typically I was going to say this one's recommended for weekly use. I was going to say, and you can do it more often than that depending on the dog. If they're like a super chewer, it may be less than that, and if they're not a big chewer, you may get a little bit more time than that, but typically a week. All right, and then let me see, I think that might have been my last slide. All right, and then this is just a few places to go if you're ever looking for more information on pet dental health. The Veterinary Oral Health Council is a really nice website that has a good explanation of common dental diseases, and then that list of products that can help to prevent dental disease. The American Veterinary Dental College is all of our veterinarians who specialize in dentistry. And then the AVMA has a really nice web portion of their website as well that explains, why we do things the way that we do, particularly focusing on, the differences between anesthetic and non-anesthetic dentistry, because that's something that's kind of a hot button topic within veterinary medicine. All right, that's all I got. I'll just keep that up. Cool. All right. So I thought I'd open it up to some questions. I think we actually have a little bit of time. Yeah. I ran a little over, sorry. Yeah. Oh.
As just a concerned dog owner,
Yeah.
brushes your dog's teeth.
Mm-hmm.
So when I brush their teeth and they love it,
Yeah.
they chew on the toothbrush.
Mhm.
When I'm brushing, they chew on it. How can I get those lower back teeth?
Mm-hmm.
Other than turning them over and putting them on my lap, which doesn't work.
And that is the question, because a lot of dogs it turns into kind of playtime, and that's where I personally have had a lot of success with the wiping, just because they're not chewing on the wipe and I can actually feel with my finger that I'm cleaning that area. It's a little bit more, I think a Daenerys, like trying to fit my finger back there would be a little bit more challenging. Her dog is really small. Well, she's not really small, she's little though. But I think that you do the best that you can in those scenarios, and that's a lot of times where if it's really challenging to hit that spot, that's where we use things like the dental treats and chews to really try to get those back areas that are a little bit harder to reach.
Can we ever get underneath the gum line ourselves?
So unfortunately, no. With pets being awake, it's almost impossible to get underneath the gum line safely where you're not. The biggest worry that I have is that to fit something small enough, you have to use something like a scaler, and those are so sharp that it's really dangerous when pets are awake, because I've seen unfortunately a pet where the cleaning was done while the pet was awake and he moved and it cut his tongue almost in half. So the scalers are really, really sharp. Like I know when I go to the dentist, like sometimes I'm like, oh, I'm a little bit more sore just because of that irritation from the scaler. So then if you try to factor in that moving patient, it gets a lot more difficult. I'm sure like little kids, I don't know how you guys do it. Yeah.
Well, you guys saved Missy's teeth. My little toy poodle, she didn't have enough enamel on her teeth.
Yeah.
So I was at a different vet to be left unnamed, and I had said, oh, this makes me want to hurl, and I couldn't see their teeth or stomach. And they go, oh, little ducks smell like that. And that's when I first came to your vet. And so then if I brought Missy in every 3 or 4 months, she didn't even need anesthesia. You kept her teeth clean. She didn't lose another tooth to be pulled till she was 10.
With that regular dental care, it makes a
And
huge
she'd
difference.
just come in and she'd pretty much say, You know, I didn't have to put her under.
She is the rarity. She really is. So she was like the cutest, tiniest toy poodles that would just literally sit there with her mouth and let you clean her little teeth.
So
It was
just come
amazing.
in all the time, save.
And it's one of those, but regular, I think it hits on the just really regular, I mean, that was part of her normal routine, and I think the more comfortable we can get with our pets having their mouths touched and having their mouths cleaned and examined, the easier things get to keep them nice and clean. And that's amazing to keep that many teeth for a little tiny 10-year-old toy poodle is amazing. Because she had most of her teeth by the time. Yeah. Okay, yeah.
So my question now is, now I have an edentulous dog, and her tongue hangs out, and it seems like it's a little dry. And I know, like in dentistry, we have like dentists that will use like dentures to hold the teeth or the tongue in place. So what can I do now to like? Is there any risk by having an edentulous dog or anything to keep the tongue in the mouth? Or?
Yeah. So did he lose a big canine on the bottom? I can't remember. Oh, all of her teeth. Okay. Yeah. Yeah. When dogs lose, especially teeth on the bottom of their mouth, particularly their big canine teeth, that's the tooth that kind of keeps the tongue in the mouth. So their tongue can hang out to the side. This isn't necessarily a problem. I think it's kind of a cute little quirk. Just having water available regularly so they can moisten their tongue, and she can retract her tongue and moisten it just with her normal saliva, so it shouldn't be a problem. Unfortunately, right now we don't have options that I've seen personally for like dentures and things like that. Yeah, they used to do. They used to do lots of like capping and things, but that's actually fallen out of favor in a lot of veterinary dental fields as well. Like they do more crown restorations and root canals than like I think of like the military dogs. They used to put caps on their canines to try to protect them, but that's not common anymore. I haven't seen that in a long time.
Will she like continue to lose bone loss without anything holding her?
So the good news is most likely not, because you've removed the source of infection, and a lot of dogs, does she still eat and chew and things like that pretty well?
I know that she'll get down on, which is kind of cool, but I'll crush it if she can't get to it.
But I have a number of dogs and cats that have 0 teeth that still eat hard kibble, and it's amazing. But that regular chewing will also help to maintain bone structure as well. Mm-hmm.
So is it better to like, sorry.
Yeah, yeah,
I had this plan on my calendar.
yeah.
So can I just keep her food like hard, or should I just have it soft or in between?
It depends on the dogs. Like
How hard do I want it to work?
So if she tolerates hard kibble and it doesn't upset her tummy, you're fine to keep doing hard or slightly softened kibble. But I have some dogs that are just like, I just love wet food. That's just what I want to eat. And then that's what we transition them to after they've lost their teeth. And it's honestly kind of a 50-50 mix of both. I see a little bit what they can tolerate, and then we go with what's most comfortable for them.
Thank you, Dr. Lindsay.
No problem. That was a good question. It's so fun having a dental hygienist here. All right, anybody else? Yeah.
Thanks.
So I recently learned of non-anesthesia dental cleaning because I have a dog with a heart murmur.
Yeah.
And so I was trying to weigh one vet is recommending an echocardiogram, and but his teeth are really bad. He needs his teeth cleaned. So I'm just wondering what you think of that.
So I will.
As a short, I know they don't compare. They're not like equal, but.
So the biggest concern is ideally for me, we would always do anesthetic dentistry if it's safe for the patient. So I think the first thing that I would recommend is making sure, is anesthesia truly a good option? So a lot of times if dogs have other diseases, so I talked about, my dog had an underlying GI issue. So for dogs that have underlying issues, we want to work those up before they go under anesthesia, if at all possible, to put that pet in the best place possible for anesthesia. So in a case like heart disease, I do think an echocardiogram is a great idea, because there are a lot of heart conditions that can be managed with just careful monitoring and anesthesia. There's a lot of canine heart disease that actually doesn't even require medications until it progresses to a later stage. So there are things investigate the heart disease more, and then come back to dental cleaning as long as dental cleaning allows it. Anything else? Cool. Raffle? All right, let's raffle. Okay, I need something. Leah has my things right here. Okay. All right, who wants to draw? I need a technician. So I have an awesome team of girls and guys that are here today from the Animal Care Center in Utah Dog Park. I needed a volunteer. Bailey, how about you guys come? Yeah. I know, and I was gonna say, she can help. She can pick. Hi. Oh, Patches, please. Patches, please pick, okay?
Okay, Patches
All right.
is picking.
All right. Patches is picking. Wow, that was adorables. All right. Oh, we got a yellow. We got a yellow. All right.
Anya Van Morum.
Yeah, woo! So you get our raffle, which is this nice little box of goodies to help encourage Pet Dental Health Month. And if these sizes don't work for you, especially for the little Oravets, just let me know. Oh, and the food. Yay! I was gonna say this is a good size too. I was gonna say, there you go. Perfect. And then we also wanted to say thank you for everyone coming. So we did during the month of February a dental health promotion. So we are giving you guys all a coupon to use that honors our pet dental health promotion for the full year. So use it anytime this year. Oh, yes. So with the dental cleanings, we did a $450 dental cleaning plus blood work and then extractions and things like that. We'll have to, those are going to be a little different. You guys are fine. All right. I need a volunteer. Yeah. Huh? Yeah, you get a coupon. Yeah.
No.
Oh.
$450?
It's a discount. Yeah.
Ignore the expiration on there.
Yeah, ignore the expiration date. Okay, perfect. And then the last thing I had two more things. So next month we are meeting here again on the first Tuesday of the month, and Shane, who is our resident trainer, is going to be talking about common leash walking problems. And then May, we actually have our groomers from the Animal Care Center in Utah Dog Park that are going to be doing a grooming seminar, which is going to be really fun. And then in June, we're actually having a whole seminar on how your pet can serve your community. We're having the Canine Blood Heroes, Canine Good Citizen Group, and Intermountain Therapy dogs coming in to say hi and visit with us. And we have the amazing Snout Snacks. You guys have your table outside. They make all sorts of fun chews and treats and things like that that are great for our active chewers. Awesome. Thank you guys so much for coming. We'll see ya.